Do you understand what it takes to be a school nurse in the 21st century? Let's dive deep into the complexities of school nursing, as well as being a Latinx nurse in the United States in 2019 with my guest Gloria Barrera, right here on episode 227 of The Nurse Keith Show. Well, hello and welcome to the Nurse Keith Show. I am so grateful you're here, whether it's your first time tuning in or you've been hanging out with me here on the virtual airwaves in the podcast world for months or years. Thank you for being part of the growing Nurse Keith Nation. This podcast is all about you and your nursing career, and I'm here to share education, ideas, diatribes, and informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, and beyond. And did you know you can leave a rating and a review for the Nurse Keith Show over on iTunes or Apple Podcasts? That's right. It really helps other people find the show. And if you would pretty please do that for me, shoot me an email at keith@nursekeith.com and I will read your review on air and thank you personally. Meanwhile, if you want to see the show notes for this episode, head on over to nursekeith.com/the word episode and the number 227. Anyway, today we are here with Gloria Barrera. She is a nurse from Illinois, and she is a school nurse, and we're going to dig deep into school nursing and many, many other things that Gloria is involved in. So, Gloria, welcome to the Nurse Keith Show.
Thank you for having me, Keith.
I'm so happy to have you. Now, you and I met at the National Association of Hispanic Nurses in Texas a few years ago, and I didn't realize at the time that you were a school nurse, and that is something that many nurses don't even think or talk about, school nurses. Do you find that it's true that school nurses kind of get the short end of the stick in nursing?
Yeah, I would agree with that statement. I think we are kind of the hidden healthcare system that a lot of us don't know about.
Mm-hmm. And, working in schools, I'm sure can be really challenging. I've talked to different school nurses over the years and interviewed a few for various websites I write for. And it seems like school nurses aren't what we used to think of as school nurses back in the 50s and 60s, or even maybe the 80s or 90s. So why is school nursing so much more complex now than it was, let's say, 30 years ago? What is 21st century school nursing like?
I would say that for today's school nurse, they are dealing with more students with chronic health conditions. That being said, there's about 56.6 million students attending elementary and secondary schools, and there's data that states that there's 1 out of every 4 that may have a chronic health condition.
1 out of every 4?
Right.
That is astronomical, but I shouldn't be surprised. So, and when you say chronic health conditions, tell us the top few that come to mind when you think of the students you care for. What are the diagnoses and conditions that often children bring into the room?
Mm-hmm. So I'll share this, that I have approximately 2,800 students that I care for. And of those, I probably see that there's a prevalence in cardiac diagnosis, students with life-threatening food allergies, students who have seizures, require daily medications, and students suffering from mental health issues.
Wow. How about diabetes, hypertension, obesity? Are those in there too?
Yes. And of course, asthma.
And do you once in a while see students with HIV or Hep C or anything like that?
I've had experience with only one HIV diagnosis in my 10 years of practice. Mm-hmm.
Okay. So some of it is quote unquote lifestyle diseases, right? Obesity, et cetera, et cetera. And then we also have chronic cardiac. So where is all this cardiac stuff coming from? Like why are we seeing that? Or is it just because those students didn't used to be going to a regular school?
Yeah, I would say that there's been a shift in where students are learning. So maybe before, decades before, they weren't integrated into the public health setting, but now they are. So a lot of the students that nurses care for in the hospital or in the clinic setting, those are the students that we are seeing every day in schools now.
Wow. No, you just said something. You said public health setting. So most people probably don't equate school nursing with public health, but it is a form of public health, right?
Yes. So I consider myself a public health nurse specializing in school nursing.
Okay. And when you go to school and get certified, and we'll talk about that in a little bit, when you go to school for school nursing and you get that credential, are you told by your professors and those who are guiding you that you are now a public health nurse?
Well, it's integrated into our education. So we have part of our certification program. It's a clinical like atmosphere where we
Mm-hmm.
shadow a school nurse. And then we also take courses related to some of the students that we're going to be caring for. So that would be students with special needs, especially.
I see. Okay. And your credentials are MSN, RN, PEL dash CSN. So we all know what MSN RN is. What is PEL dash CSN?
So that's the school nurse professional educator licensure with an endorsement in school nursing.
So professional education licensure, PEL, and then
Mhm.
CSN is certified school nurse.
Yes, and so that recognizes the unique knowledge required for nursing professionals in the education setting.
I see. Okay. And you said a few minutes ago that you're responsible for 2,800 students. And
That's
is
correct.
that elementary school?
So I'm currently practicing in a high school.
Oh, it's high school. And is it
Mhm.
one school where you have 2,800 students?
Yes, so I'm part of a two-district high school, and in my one high school, that's how many students I see.
Oh my God. Okay. That's a lot.
It is.
uh, is that normal? Like for one nurse to have to kind of carry the load of that many thousand of students? Not that you see every one of those 2,800 students, but that's still a big student body. Is that normal for one nurse
Mhm.
to have that kind of caseload?
Well, I'd like to correct that. I actually that is my caseload, so I do have to service them. But just to put that into perspective, for last year, the number of student visits to the nursing office was 7,988 students.
Oh my
Um,
God. Wow. My mind is blown already. Okay, go ahead. That's a lot of visits.
That is, yes. So the National Education Association estimates that there is one school nurse for every 2,893 students in Illinois. So that's compared with one for every 275 students in Vermont, for example. So would
Whoa,
that
that is an
be?
enormous difference, Gloria.
Yes, yes. So it's probably not ideal, but I think we're getting there.
Okay. So let's go back to like 30 years ago, right? So
Mhm.
students who had trachs or had cerebral palsy or we were in wheelchairs with different conditions or who had other chronic health conditions or seizures, they were not mainstreamed 20, 30 years ago, right? They were going to other types of programs in order to receive the care and education they needed. Is that correct for the most part?
Yes, that's correct.
Okay. So are you aware yourself of the history and when this big shift started to happen? Was it this century? Was it the end of the 20th century? Like, when did schools start to have all these mainstreamed kids who have all these various conditions? When did that start to shift?
I think it would be this century
Hmm.
that there was that shift of having those students with chronic health conditions being just mainstreamed because of students with special education services. Now they were able to have an education in the public health setting.
I see. And,
Mhm.
if I just called up a nurse right now, like some random nurse, and said, hey, what do you think a school nurse does? Or if actually,
Mhm.
let's not even say a nurse, let's say a regular layperson. They might say, oh, they give out aspirin to students and they take care of them when they fall and cut their knee or, stuff like that. Unless they're a parent and they're really aware of what a school nurse does. But it sounds like to me that you could be doing trachs, you could be doing G-tube feedings, you could be dispensing meds, dealing with emergencies. I mean, your level of expertise that you need in the school setting, caring for so many students, must be pretty high. You have to know a lot about a lot.
Yes. So I would say that it's the equivalent of the same practice that you would see in like an urgent care setting. That's the same that we see in a school nursing office, but with less resources. So of course we can't start IVs or any of those type of interventions, but we still see those students, and we have to make sure that they're referred out to get the care that they need after they're seen.
I see. Okay. And to become a school nurse, you have your MSN, you have your RN. How does one go about getting this certification? And do you need the PELCSN certification in order to step foot in an office and serve as a school nurse?
So right now there is a shortage of available nurses with the school endorsement. So the stopgap measure would be to hire RNs without the PELCSN certification. However, to really be specialized and to care for the students that are seen daily in our office, that PELCSN really is the gold standard here in Illinois.
And is it the gold standard in other states too? Are you aware if that's true around the country? Here in the United States?
I would argue yes, because that is the position of the National Association of School Nurses.
I see. Okay. So, let's say there's a nurse sitting out there listening and she works in PD. Like maybe she works on PD oncology floor, or I don't know, maybe even in a clinic where children are seen. If that nurse thinks, I think school nursing would be kind of cool. I could have teachers' hours. I could probably have summers off and holidays off and weekends off. If she wanted to explore, I'm assuming she could speak to someone like you and say, hey, what is it like? Mm-hmm. But if she really wanted to go for it and she already had an RN or an MSN or a BSN, does she just have to sit for this exam and get her certification and then she can start applying for jobs?
Well, there's also a 300-hour internship under supervision that would be also required here in Illinois. So that would be included in the licensure program.
Okay. And if that nurse wants to find out what's required in her state, say she lives in Pennsylvania or New York or something, does she call the Board of Nursing? Should she contact the National Association of School Nurses? Where does she get the information so that she can make the right choice?
I would point anyone towards the National Association of School Nurses for further information, because I think that every state differs, and I can only speak to what Illinois requires.
I see. Okay. Mm-hmm. Yeah, this is really fascinating. I mean, I love children. I've never worked in PD. I've worked in clinics where I, gave immunizations and stuff like that, but I've never really worked with kids per se. But I love them, and I'm assuming you got to love kids to be able to do this job.
Yes.
Because they're like, you're there all the time with all these kids and you've got to really enjoy what you do, right?
Yeah, I would really say that my passion is public health and improving child health outcomes in our most vulnerable populations. So I'm committed to the vision that every child, no matter their zip code, have access to a school nurse.
Yeah, that's wonderful. And we need people like you because our kids are the future, right? It's a cliche, but it's so true. And, here in New Mexico, where I live, it's, I think, the third least populous state by per capita per square mile in the country. I think Wyoming might be number one, or Montana or something. But we have big, big, big open spaces here. And one of the struggles we've had in New Mexico specifically is keeping funding for school-based clinics. Because when you go out to these very remote counties of New Mexico, I mean, really like out in the middle of nowhere in the high desert, you often have hundreds of miles to go in order to get to a real clinic or an actual hospital, really far. So what we find is that these school-based clinics, some of them serve the kids, but they also serve some adults as well, because it could be the only place people get any care other than going to the emergency room. So school-based clinics are important here for different reasons. And in, let's say, Chicago and around Illinois, you're a much more populous state. So I'm assuming that when you work in a school in Illinois, you're really only going to be treating children and you're not going to be really treating anyone in the outside community. Is that true? Is that a safe assumption on my part?
That is a safe assumption, but oftentimes for students without insurance, I'm their only access to a healthcare provider, much like you described.
Wow.
It's something that's been almost a tagline for NASN that is backed by evidence that healthier students are better learners. So, for example, studies have shown that having access to a full-time school nurse and providing asthma education programs to students and sometimes to their families leads to improved symptom management and fewer school absences. So, even though we're not directly providing services for families, we still are giving education.
Right. I was going to say, if a parent comes in and maybe they're not educated enough about the child's asthma, and you're the only healthcare provider that child sees on any regular basis, maybe other than urgent care or the emergency room, you're going to have to sit that parent down and say, here's a pamphlet about asthma. Let's talk about how to use a spacer, right? You do all that kind of
Correct.
stuff.
Yes.
Yeah. And when your child's having an asthma attack, use this rescue inhaler. When they need their maintenance, this is what you're going to do. So you have to do tons of education of adults and children.
Yes.
And do you also educate teachers? Is that one of your roles as well?
Yeah, so I always see the students, staff, and the communities as the people that I care for. So I just don't stop with the students.
Okay. And when you say care for as well, I'm assuming sometimes, I'm making a lot of assumptions today, I'm sorry. I'm assuming
Fine.
that, if a teacher's having an asthma attack or twists their ankle or has cardiac symptoms, you're the one who's going to be triaging them and figuring out what the heck's going on, right?
Yes, I would often be called first and then take it from there once I identified that it was a staff member, making sure that emergency response is followed up with.
Right. Wow. So nurses are wonderful people, and they also can be very judgmental of one another. And me, for instance, I'm an entrepreneur. I don't work clinically anymore. And I think there are probably nurses out there who think, oh, Keith's not a real nurse. He doesn't really see patients anymore. Right. And someone who works in the ICU or the ER or whatever might think, oh, a school nurse? Oh my God, that is such an easy job. So how do we educate, or do we choose to educate other nurses so that we can elevate the specialty of school nursing and have student nurses and other nurses understand how important school nursing is and the vast complexity of what you do? How do you get that point across, and who do you talk to?
Well, I can say personally that I try to make it my personal mission just to speak about my specialty, because a lot of times I run into colleagues and they really don't know what a school nurse does, and also I teach. So I adjunct teach at several universities, most notably DePaul University and my alma mater, St. Xavier University here in Chicago.
Okay.
And I make sure that I integrate the school nurse's role within my courses. So I teach legal and ethical issues in nursing, community health nursing, nursing leadership, advanced physical assessment, just to name a few. But I often just try to sprinkle in there wherever I can school nursing, so that the students also are aware that this is a specialty and that there's a lot that goes into this.
It's an important specialty too. I mean, what could be more important than making sure kids are healthy enough to learn, right? I mean,
Right.
they're going to be the next senators and business leaders and politicians and police officers and people in the military, I mean, they need to learn so they can get out in the world and make change, right? And do good work in the world. So
Right.
we're going to take a quick break. Don't touch that dial. When we come back, we're going to talk more about the school nursing and underserved populations. But I also want to talk about your work with the National Association of Hispanic Nurses and all the other work we do. All the other work you do, not me do, that I do. So don't touch that dial. We'll be right back. So now we're going to take a pause for the cause for just a moment. Please consider becoming a patron of the Nurse Keith Show, just like other listeners who value the show so much that they want to give just a little bit each month to support the work we're doing here. When you pledge, you not only get the satisfaction of helping produce and support the show, you also get some pretty nifty premiums and gifts directly from yours truly. Just head over to patreon.com/Nurse Keith to read all about it. That's patreon.com/Nurse Keith. Also, please consider signing up for my newsletter at nursekeith.com so that you can receive my bi-weekly message just for you. Finally, if someone you know could benefit from career coaching with me, please consider referring them. And if they become a paying client, even if they do one session, you'll receive credit for 1 hour of coaching with me, and there's no expiration date on that credit, and you can keep it in your back pocket until you need it most. Remember that you can refer as many people as you like and continue to earn those coaching credits over time. What a deal! Those are my sincere asks of you, dear listener. So now let's dig back into today's topic. And we're back. Thanks for hanging out with me here and school nurse and amazing individual Gloria Barrera. We're going to talk more with her in a second. This is episode 227 of the Nurse Keith Show. And of course, the show notes are at nursekeith.com/the word episode and the number 227. Gloria, thanks for hanging out here for the second half. And before the break, we were talking about school nursing, how important it is, how, the different people who you educate and treat, how many thousands of students you're responsible for, and the thousands of visits you do every year with those students. And we were also talking about some of your, well, this might be a funny word to use in this particular context, but your extracurricular activities outside of school. So you are a certified school nurse. You are an adjunct professor of nursing at 2 different universities in the Chicago area. We covered that. Now, you and I met at the National Association of Hispanic Nurses Leadership Institute in January of 2018 in San Antonio. And that was really fun. And I'm so glad you reached back out to me. Now, tell us about your involvement with NAHN, the National Association of Hispanic Nurses. What do you do with NAHN? And tell us why NAHN is so important right now.
Well, I currently serve as treasurer of the National Association of Hispanic Nurses, the Illinois chapter. And the reason that it's important is because it's the nation's leading professional society for Latino nurses. So for me, it's really important to make sure that I educate the next Latino nurse or Latina nurse, and just try to role model for them to be all that they can within our profession. So we do advocate, educate, volunteer, and seek partnerships with conducting programming in our community to improve outcomes, elevating literacy, heighten education, and influence policy.
Wow. Okay, that's a tall order. A lot of important stuff that happens with the National Association of Hispanic Nurses. And, I don't even know the statistics right now of what percentage of Americans are of Hispanic origin, but it is huge, isn't it?
Mm-hmm. Yes, and what's striking is that only less than 7% of the nursing workforce is of Latino descent.
7%?
So what NAHN? Yes, 7%. So what NAHN does,
Okay.
it provides an opportunity to network with other Latino nurses.
I see. Okay. So I've read and heard through, I think it's either the census or the Bureau of Labor Statistics, I don't know, that by 2030, 2030, or is it 2035, that the United States will be 50% Latino. Is that about right?
I think, yeah, I've heard those statistics.
Yeah. And when we talk about a Latino population or a growing Latino population, we also have to talk about, drumroll please, we have to talk about immigration, right? Mm-hmm. So, of course, this is important in states like Texas and here in New Mexico and Arizona and California, all the states that border Mexico, our southern neighbor, of course. Mm-hmm. But we have legal and illegal immigrants all over the country. Right? I'm sure there's plenty in Chicago and Illinois too, in those surrounding areas. So when you're working in either a school or a hospital or anywhere, and you come across someone who you think is undocumented, what do you find most nurses want to do with that information or not do with that information about someone's documentation status?
Well, it's really interesting that you asked that question. I just came back from a Latinx nurse conference. So this was the last week on Thursday and Friday. Mm-hmm. It was held in Greater San Jose. It was their conference through the National Association of Hispanic Nurses, that chapter, and it was really interesting that I got to just hear how to best serve the community across borders. That was the name of their conference, Healthcare Without Borders.
Wonderful.
And it kind of gave us the tools that we needed to address social determinants of health related to, like you mentioned, sometimes undocumented people.
Yeah. And undocumented people, I've read and heard, they often don't want to go to the ER because they think they're going to be discovered that they're undocumented and then turned into ICE or something. Mm-hmm. So there's lots of fear out there, and there's reasons to be fearful right now in this country and other countries as well. But here in the US, there's a lot of stuff going on politically. We're not going to get too deep into that. But needless to say that it's a scary time for a lot of people out there of Hispanic origin. And you just used a term that I want to make sure someone listening didn't feel confused by. Mm-hmm. I've heard this term before, but I want you to explain it. What is Latinx?
Oh, sure. So that's kind of a newer term. I'm still learning to kind of use it myself. So before, the term that was widely accepted was Latino. And now Latinx is saying that it could be either female or male, because Latino, of course, has more of a male connotation to it.
Right, because it's a gendered language. So you have O is for male, A is for masculine, feminine.
Yes,
right?
That's correct. Mm-hmm.
Yeah. Okay. So Latinx is what people are using. And this isn't just political correctness. This is actually trying to identify a group and give it a identity that means something, right?
Correct.
So Latinx is what's being used to kind of identify the wider Latino or Hispanic community.
That's correct.
And I'm fairly bilingual and have worked in the Hispanic community a lot throughout my tenure as a nurse these last few decades. Mm-hmm. Sometimes people in my position, or people who know even less than I do, are confused whether to call someone Hispanic or Latino. And can you elucidate for us, if possible, why we get confused, and if there's a way for us to be less confused, or is there no place for confusion in that particular respect?
I still use Hispanic. Of course, looking at the association, it has it still. National Association of Hispanic Nurses.
Right.
It doesn't say Latinx nurses. So I think that it can be used interchangeably, but with maybe peer reviewing articles, or if you're writing for a publication, then it would be Latinx.
I see. Okay. So that is really making its way into academia, Latinx, right?
Mm-hmm.
Okay. I always was told back in the day that Hispanic referred more to people with of Spanish origin, like Spain, Spanish origin, and the Latino or Latina referred more to Central and South America. But I've heard that that's not quite accurate anymore, and that we're moving away from trying to divvy up the Hispanic or Latino community because it's such a wide community. And, you know, here in New Mexico, this is a very Latino or Latinx state. See, I'm starting to learn how to use the word.
Yes.
I'm trying to get there. I'm trying to be better. So this is a widely Latinx state and very Catholic. And we have mostly New Mexicans, people who have been here for centuries, like generation upon generation. Many of their families came from Mexico, but many came from Spain too. So it can be a little confusing when you have all these different communities. So it's just an interesting exercise in our culture right now to figure out how to refer to a particular group, and we want to be respectful. So you're with the National Association of Hispanic Nurses Illinois chapter, and I understand that you represent the American Public Health Association's Public Health Nursing section in the Nursing Coalition on Climate Change and Health. Is that right?
Yes.
Let me say that one more time if there was a listener out there who wasn't paying attention. You represent the American Public Health Association's Public Health Nursing section in the Nursing Coalition on Climate Change and Health. Can you tell us something about that? Because that is a mouthful and there's a lot to unpack right there.
Yeah, so actually, I also serve on that, and then I also serve on the Alliance of Nurses for Healthy Environment for their policy and advocacy committees, and also their climate change committee. So what I've sort of identified was that with my work in public health, I've been seeing that there's an increase in chronic illness such as asthma related to the environment. So that is something that I've kind of developed a passion for within public health.
And what is the conversation happening within these organizations around climate change and its relationship to health and vice versa? What are you hearing right now in 2019 about these issues? What are the things that are top of mind for you right now?
Well, for me specifically, as a school nurse in Illinois and within my practice, I've been noticing an increase in the amount of students with asthma. So on average, in a classroom of, let's say, 30, there's about 3 students that are likely to have asthma. So to address this concern, I'm just working on the better management of asthma in schools, and then also educating about the impact of air quality on student health.
And you and I both know, and we won't go deep into the politics of this, of course, but
Sure.
Well, we could, but we're not going to. That some people say, well, climate change isn't real and kids have asthma because they have asthma. But you and I both know that something's going on out there, right? And do you see the rates as a master's prepared nurse interested in public health? Are you seeing these major changes, and does it give you very large cause for concern?
Yeah, I would say that is a cause for concern. And I am kind of making it one of my priorities to just speak to legislators on the need to really have improved policy on air quality.
Right. And if we think about climate refugees, there's going to be more and more of those as the years go by. I mean, desertification, and I'm not talking about desserts that you eat. I mean deserts.
Yes.
The desertification around the world is growing, and we're going to have areas, either desertification where people are refugees because they're trying to find a place where they can actually live that's hospitable. And then we have entire island nations out there in the Pacific, for instance, that are disappearing. So we have fires, we have tornadoes and hurricanes, we have droughts, we have flooding. There's a lot of stuff going on. And then we also have to worry about the impact of the sun on people's health as the atmosphere changes, right? So there's a lot of things going on. And I'm so appreciative that you're involved with the American Public Health Association working on these issues, and also the Alliance of Nurses for Healthy Environments. And that Alliance of Nurses for Healthy Environments, is their mission around environmental issues only? Is that what they're focused on? Environmental health?
I would say yes. It's well, they focus on the environmental health in the U.S. and then also globally. So there is a global aspect to well, the acronym is ANHE, so it's ANHE.
Okay, got it. Okay. So as we start to wind down, I want to turn the clock back a little bit back to school nursing for a second. So when we are talking about school nursing, whether it's with the Latinx community or not, or whatever you happen to be doing, what is one of your goals or several of your goals for that particular specialty? Is there something that you want to see happen that you think is actually a realistic wish for your particular specialty and the area that really captures your heart and your mind?
I would say within my lifetime, I really am committed to that vision that
Hmm.
every child will have access to a school nurse here in Illinois.
Okay, that's great. And around the country also.
Yes.
And in terms of the specialty, it sounds like one of the things you do as part of your mission, if I may,
Hmm.
is you, in the universities where you teach nursing, you make sure the students understand the importance of school nursing,
That's correct. Yeah. So just
right?
to make sure that there's an awareness of the specialty of school nursing, so that it can be elevated.
Okay. And then tying this back together to what you and I have been talking about since the break, in terms of the Latinx community, whether it's children or adults or whatever, what are several of your goals or part of your mission personally and professionally around the Latinx community and their health collectively and individually?
I would say that to have just the promotion of academic attainment for Latinx nurses and for there to be more mentorship and professional development, and then to also reshape healthcare in the Hispanic community through our chapter and through the National Association, just to provide more care to people that look like us. So there's no gaps in how we provide care because we look like the patients that we serve.
Right. And I've seen some research. I don't think it's anecdotal. I think it's more academic than that, that when a patient sees a provider who
Hmm.
looks like them or comes from their community, they're much more likely to follow that provider's recommendations. Do you think that's true?
Yes, and it leads to then improved health outcomes.
Mm-hmm.
Hmm.
Right. Okay. So you have a lot on your plate. You are trying to elevate, well, you are elevating the profession of school nursing,
Hmm.
and at the same time, you're also working to elevate the health that's being delivered to children
Hmm.
of any race or color, et cetera. And
Hmm.
you're also looking at how to improve outreach and outcomes for the Latinx community, which is a large community of people from many, many countries around the world,
Hmm.
right?
Yes.
So that's a lot for you to accomplish. And before we go, is there anything about either of these main subjects, school nursing and the Latinx community, is there anything we haven't mentioned that you'd like to make sure we get into this conversation? If there's not, that's okay.
Well, I just like to again highlight that as school nurses, we are at the front line of disease surveillance, and we serve as change agents within our schools and the community, and that we ensure students have access to primary, secondary, and tertiary prevention measures. And like I mentioned before, we are the hidden healthcare system in the U.S., and I'd just like to have more conversations about what it is that we do and how we can improve.
That's very, very important. Now, in the show notes at nursekeith.com/episode 227, we're going to have a link to the National Association of School Nurses, which is nasn.org. We're also going to have a link to your LinkedIn profile so that people can connect with you there. If you try to connect with Gloria, please send her a personalized message. That's what I'm always teaching people about LinkedIn. Don't just send her a generic message. Say, hey, I heard you on the Nurse Keith Show. And you will also have a link to the National Association of Hispanic Nurses, and anything else that you want to make sure I have, just send it over to me and we'll have it there for people who are listening who want to connect with everything you're talking about. And Gloria, one last question. So in your professional life, from this point forward, and you're young, so you've got a lot of years ahead of you. You don't have to tell us how old you are, but
That's okay.
Is there something that you want to accomplish? Like, do you want to get a PhD? Do you want to, be a senator? Like, is there something that you're looking at that you would like, that you're working towards, that you're willing to share here on the show?
Sure. I think that, yeah, at some point within the next 5 years, I would like to earn a doctorate. I'm not sure yet if it's going to be a PhD or a DNP, but I do know that
Okay.
it'll serve within my scope of practice and definitely serve my passion. So that would be in public health and looking at the Latinx communities and or school nursing.
Okay, so PhD or DNP, and you'll do some research in that process, I'm sure, and which you could publish then. And another question I have for you, do you have a book inside you that you want to write?
I'm not sure.
I put you on the spot. I'll tell you, as a writer, as a nurse writer, I just see that you have so much expertise, you know so much, and you have so many different passions that I feel like a book by you, either about school nursing or even more about being a Latinx nurse and what that means, or about the public health issues that you see in the Latinx community, I think that could be a really important book for you to write. So let's check back in 5 years and have you on when, you're on the New York Times bestsellers list.
I think it would be a really important book for me to read. That I would agree with you.
How about write, though?
Yeah, so
I'm
right.
teasing you. I'm sorry.
Well, it's because it's not written yet. So I think that there's a gap there. So I think you gave me something to think about.
Okay, you heard it here, folks. You heard it here first, folks. Gloria's writing a book. It'll be out in a few years, and she'll be back when she's on the New York Times bestseller list. So there you go. Case closed. All right. Well, Gloria Barrera, you are amazing. You are a force to be reckoned with. And thank you for doing such wonderful work with children and communities of color and underserved communities, and also for being a champion of the Latinx community around the United States, and specifically in your beloved Illinois and Chicago too. So thank you for all the wonderful work you do. It's really impressive.
Thank you. Thank you so much for saying so. That means a lot coming from you. I just wanted to really say that because of listening to your keynote address back at the Latino Leadership Institute, you told us to think boldly about our roles and to aspire to be inspired. And that's what I'm trying to do.
I said that?
You did.
No, I know I did. Well, thank you. That's very kind of you.
Thank you.
Well, there you have it. Thank you for listening to this awesome episode, I must say myself, of The Nurse Keith Show. Remember, those show notes are at nursekeith.com/the word episode and the number 227. You can reach out to Gloria Barrera and also look into all these amazing organizations in which she takes part. I hope you feel uplifted, empowered, and educated from this episode. I certainly do. And I encourage you to take inspired action every day in the interest of your personal and professional satisfaction and happiness. And did you know there are job listings at nursekeith.com? That's right. You can find jobs from reload.com and ZipRecruiter in the resources section drop-down menu at nursekeith.com. nursekeith.com. There are other resources there for you as well. Please check them out. The Nurse Keith Show is edited and produced by Tim Hollowell and his wonderful team at thepodcastinggroup.com, and Mark Cappy-Speason is our social media ringmaster. Please keep tuning in again and again as we continue to explore how to powerfully and consistently elevate your nursing career and your life into your very own personal and professional stratosphere. Be well, dig deep, seek joy, keep in touch. And this is Nurse Keith saying adios until next time from beautiful Santa Fe, New Mexico, and Gloria Barrera saying goodbye from
Chicago.
Chicago, Illinois. Thank you, Gloria, and we will see everyone on the flip side.